Hi, I'm Neeraj Jain. I'm the director for South Asia for PATH. The COVID pandemic actually has brought health to the front of everything that we were talking about. So in terms of development agenda, the good thing is health is right up front. I think we've got the mandate, we've got the political will, we've got the funding. The challenges ahead that we need to really tackle with are going to be around primary healthcare. We will have to strengthen that. We'll have to get closer to our people. We will have to ensure that our diagnostics as well as our screening tools are much stronger so that we can quickly find out about challenges that occur within the health system. That's going to be a large area of work for us, the diagnostic piece. And finally, I think the challenge is going to be how are we going to build this into a resilient data system. So digital will play a large role because with the number of healthcare providers we have and the large country that we are working in, digital will be the only way we can leapfrog healthcare services to the entire country. The G20 presidency of India is a fantastic opportunity. The interesting thing is that if we look at the G20 Troika, which means the three countries, one before India, one after, it's Indonesia, to India, to Brazil, and after that South Africa. So this is really the time for the global South to stand up and make a huge impact on low and middle income countries. India's got a very strong agenda at the G20 in terms of health. Three major areas. One is pandemic preparedness, which is absolutely sort of front and center for us. How are we doing the surveillance? How are we talking about being ready for the next pandemic whenever that happens? The second big area for the government of India is around how do we create collaboratives across the globe, across the G20 countries and beyond, which are not just focused on the North narrative, but more on the South narrative and the North-South narrative, trying to bring both of these together to see how we're going to collaborate for research around pharmaceuticals, vaccines, diagnostics. And that formation of those collaboratives and those regional conversations will help reduce the inequity that exists in health across. And we saw a lot of that during the pandemic. So that's a big agenda item. The third big agenda item is digital. With COVID, we've proven that we had the best vaccination digital program probably in the whole world. There are various other eSanjeevani, which was a telemedicine platform that got rolled out, hit about over 100 million transactions now. Another big area of interest to the rest of the world, and really trying to reduce the inequities around health services with the use of digital technologies. During the pandemic, everybody came together. The private sector, the public sector, academia, researchers, everybody came together and everybody was talking to each other. However, there was a certain sense of national identity, nationalism. We talked about vaccines, so we saw a bit of vaccine nationalism happening. So a lot of that also played a little bit of a part because we were all scrambling. I think the idea of pandemic preparedness should be around equity, focused on equity, and really build those collaboratives which will ensure that we are able to reach the entire population of the world in the next pandemic. A lot of these actually got set up, some like the ACT at WHO, which brought a lot of ideas together. Gavi had the COVAX collaborative, not very effective initially, but eventually it did come through and provided vaccines to many countries which were left out. So those kind of collaboratives are going to be absolutely key for us to be prepared for the next pandemic. Finally, surveillance, having data, having information which comes in quickly. So if you see an outbreak of some sort, we're getting that data. We have good sequencing capacity. One of the good things that happened during the pandemic was that a lot of health infrastructure got built. And not only did it get built during the pandemic, but a lot of funding has been set aside to build the whole diagnostic system. There are diagnostic labs, government diagnostic labs coming up in every district, every block of the country. The primary health centers are getting strengthened in terms of surveillance, etc., diagnostic. So a lot of that infrastructure is already created. Now it's time for us to build those systems to be collaborative, share data, and really move forward to be able to identify a pandemic as soon as we see one. One of the great things that happened during the pandemic, and of course it was triggered by challenges that we saw, was really around the infrastructure on things like oxygen. We realized that while our big towns, the good hospitals did have that support system, but we were quite dependent on various other modes to be able to get that. I think the government of India did a fantastic job, and they put in a lot of money to build that infrastructure. And PATH, of course, was very much a partner with government of India in that process. And now we have infrastructure to deliver on oxygen across the country. Just to give you an idea of the numbers, from 3,000 tons, we suddenly had a demand of 11,000 tons. And there was a period of 2-3 weeks where we felt that there was a need for an emergency movement, etc. But today we are in a situation where we have substantial assets on oxygen, we have substantial supplies. We probably can run through a similar or even a worse pandemic without any challenges. So PATH works around the world in health. Our focus is on health equity. So we work with people who really are not able to get good quality health services as they should. Within India, we work in multiple areas across all infectious diseases, tuberculosis, HIV, COVID, we've done a lot of work, all the vector-borne diseases, malaria, etc. We work on maternal health, child health, neonatal health, little bit of nutrition. We work on vaccine development. Many vaccines that have been successfully rolled out in India have come from with support from PATH. We work across in primary healthcare, lots of primary healthcare work that's happening, really looking at comprehensive primary healthcare, more from becoming more patient-centric. So as the patient walks in with a certain symptom, how do we treat? So supporting the government. Of course, the government program is rolling out and we are supporting them. A lot of work on digital health, looking at how are we going to get our entire population under that umbrella. Similar to what the universal payment interface has done, brought a lot of people into the system. I think that's going to be required for health, because that's also going to give us the kind of data we need for disease preparedness, pandemic preparedness, and also ensuring that we are taking care of the kind of therapeutics that are going to be required for that. So there's a lot of work in digital that's happening at the moment. We finally, there's a lot of conversation also around how do we improve our research capacities, our development capacities within the country. We are 60% of the world's vaccines actually now come from India. So that's a big achievement. We are the pharma factory of the world. Big achievement. How do we build so that we are able to actually do a lot of breaking research, which is going to be cutting edge for the rest of the world? I think that's going to be a challenge that we'll have to work on.